Ooh, on today's episode of Face the Facts, we're going to be talking about something very spooky, and that is ischemia. My name is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery, and today we're going to be talking about ischemia, or as my colleague thought it was, ischemia. But basically what this is when you have decreased blood flow, thus decreased oxygen supplying any tissue. And this can happen because you either don't have good oxygen coming in or you don't have good stuff coming out. And this is seen in many places in the plastic surgery world. It can be when you have filler injection. That's where you hear this thing called venous occlusion. You can have it when you're doing breast surgery, and I am not an expert of this, but you can hear about nipples going ischemic. In my world, we talk about the nose, we talk about the face from the face flaps. So all of those have the possibility of going ischemic. And the worst part about ischemia is if the tissue is ischemic too long, it can actually die. And that leads to something called necrosis. We don't want that because not only is that a source of infection, but it also means we'll never be able to recover that tissue again. And we will have to find some other way to get tissue into that area. What are the risks for ischemia? Anything that you can imagine that decreases blood coming in or out of an area. So that would be things like smoking, diabetes, any kind of cardiac issues, heart issues, things like that. Those can all be risk factors, and that's why we tell you to try to optimize these things as much as we can before surgery. And then last is, well, what can we do about this? Hopefully, if we think that something is ischemic and we catch it early enough, there are a couple of measures we can do to try to save it before we get to the dreaded necrosis. And that could be things like hyperbaric oxygen, aspirin or other blood thinners like heparin, maybe even doing nitro paste to open up the blood vessels, or, you know, my favorite spooky one is leeches. And yes, they are still used in medicine today. I hope you learned something today on this very spooky episode of Face the Facts. My name is Dr. Lexie Wang. I'm located in Washington, D.C. at West End Plastic Surgery.